Okay, so this will be an in-depth review of the exact assessment process that I go through with my patients to determine the best initial treatments for their sciatica pain and symptoms. There's a lot of information that I will not cover in this video that is covered in another video explaining the desired effects of the treatments overall and kind of what we want to look for during this assessment. So this video will specifically just focus on the assessment itself. So please watch the peripheralization and centralization video that's linked here. Just as a reminder though, we do want to focus on the most distal symptom throughout this whole assessment process. Again, watching the other video, you will kind of understand that a bit more, but the most distal symptom when dealing with the sciatica symptoms is referring to the symptom that's the furthest down your leg. So say you have a kind of band of discomfort going from kind of the hip all the way down the back of your thigh to your knee. We are only going to pay attention to that symptom that's furthest down that chain. So the most distal, furthest away from, the one that's furthest down that leg. So you're only paying attention to that symptom there. And then that is kind of how we are going to gauge progress or regression with the assessment. And then at the end of this video, you will be able to determine if you are what we call flexion biased or extension biased. Again, that will just give you a good jumping off point in helping you determine which kind of group of movements or exercises you'll start in. And then based on the outcomes of this assessment itself and the notes you'll be taking, you will kind of know which exact movement to start with. So the very first thing that you are going to do is make an exact note in a standing position like this of where your most distal symptom is. And then what I'm going to do is use that as my starting symptoms. Again, you reference the picture in this guide here that kind of explains and demonstrates maybe what a full detailed assessment will look like on paper, so you can have something to reference as you are writing yours down as well. The first thing you are going to do then is a forward bend. So going to, with your knees straight, reach as close to the ground as you can. Again, you do not want to be bending your knees doing this, so keep your legs locked and down and up. So this you'll be doing 10 times. After that, you will assess, you do 10 reps, you will assess exactly where your most distal symptom is again, if it's moved location or if it's changed intensity. We'll do a second set of 10, again assessing if there is any change or in intensity or location. And then if there is not, I will do a third set of 10. So the most you will ever do is 3 sets of 10 of a movement. And again, at that point, if there's no change at all, then I will move on to the next movement. So now imagine I did my forward bends and I come up, I'm like, okay, that moved further down my leg now. The most distal symptom is down behind the back of my knee. And say it's a 3 out of 10. So again, going back to the centralization and peripheralization video, even if the pain overall is less, but it moved further down your leg, that is still peripheralization, and that is what we do not want to promote. So even though, again, it is feeling better, quote unquote, less pain, but it is further away, that means we are doing something to aggravate that nerve more. At any point in these assessments, you are noticing peripheralization of your symptoms, that is a good cue to just stop that movement altogether. Know that this is not something that you should be doing, and you can move on to the next portion. So if during the standing portion here, I'm doing my forward bends, if you get that peripheralization, you are immediately going to stop. And then if you get centralization with that, you are going to move on to the list of flexion exercises. Starting at number 1, making your way through the end. If the forward bends here caused peripheralization, you will next be performing a standing backwards bend. So putting your hands on your hip like so, and then arching back and up. Now, I'm going to keep my legs straight, so I'm not bending my knees like this, because what I'm trying to do is move my spine. So I'm going to be here, arch, and back up, arch, and back up. I'm going to do that 10 times. I'm going to make an exact note of, did my symptoms change at all? Did they change location? Did they change intensity? And again, paying only attention to the most distal symptom or the one furthest down your leg. Again, just like with the forward bends, you're going to make an exact note of the location and intensity of the symptoms before and after you do that movement. And again, if this caused peripheralization, so again, anything that sent it further down the leg, or it stayed in the same spot but got worse in that same spot, that is peripheralizing. If it moved up your leg, if the most distal symptom is now further up your leg, or maybe it's completely gone, that's centralization. If the most distal symptom is further up, but even though it's worse there, so say it went from a 4.5 here to a 6 up here, that's still centralization. That is good. That's what we want. So if you also got peripheralization with the backwards bends, then you are going to go back to the flexion exercises, starting at number 1 in that hook lying position. If you got centralization with the backwards bends, then you are going to go immediately into the extension biased exercises, starting at that prone position, laying with 2 pillows under your hips. Now, if both the forward bends here, those, and the backwards bends caused peripheralization, you are going to start with the flexion-based exercises in that hook lying position. It is possible for both of them to cause peripheralization because we are in a weight-bearing position, and sometimes the movement might be beneficial overall, but since you're in a weight-bearing position, we're causing a relatively increased amount of compression through the spine, which is maybe sometimes not tolerated. So we are going to go to the unweighted exercises laying on the ground. Okay, so we're getting close to the end of this video. So I explained how to find your starting point here for the assessment. Now we have the full list of flexion-based exercises and then the full list of extension-based exercises. So you should have a good idea of which one to start with. If you start with the flexion-based exercises, you are going to start in that hook lying position. You're going to rest in that position for 2 minutes, again, making note of your most distal symptom pre doing that movement and then post doing that movement, seeing if there's any change in the location or the intensity, determining is it peripheralizing, is it centralizing. If it is peripheralizing, then you're going to move to the extension-based exercises. If it centralized, you are going to move on to the next flexion-based exercise. So as long as we are noticing centralization or no change at all, you're going to keep progressing through that block of movements. But the minute you kind of get to a state of the symptoms peripheralizing, then you are going to move on to the extension exercises. And again, starting with the extension exercises, starting with the prone position with the 2 pillows underneath your hips. Again, you are going to rest in that position for 2 to 3 minutes. Again, making a note pre and post doing that movement, where are your most distal symptoms and what are they doing in response to that movement. Again, if you are getting peripheralization at all, then what you're going to do is stop that movement right away. And then you are going to look at the list overall of the movements you were able to do. And you're going to look at what caused the most centralization. So this can be kind of confusing because some things might help, but other things might help more. Now you're going to look at what causes the most centralization. You're going to pick the exercise that caused the symptoms to move closest to the source. Now, if you're going through this assessment and something completely centralizes your symptoms, meaning takes all of the symptoms away, you're still just going to progress through that list to keep doing the movements in order until you get to something that does not cause any centralization, or I should, on the flip side, say it causes some symptoms to show back up again. If you get through all of those flexion exercises and you still have no symptoms, then you are going to move on to the extension exercises. And starting with that prone position, 2 pillows underneath your hips. And at that point, if you continue to have complete centralization, going through all of the prone exercises, all the way through the press-ups with the hold, and then the standing extensions, you're going to do is pick the standing extensions as your centralizing movement, and that will be part of kind of your rehab protocol. This is a lot of information, so the more you write down, the better. Taking notes during the assessment portion is crucial because that will give you an exact reference of what stimulus you are responding to and like what things are causing centralization or peripheralization, or if they're not causing any change at all, kind of giving you that framework to keep progressing through that assessment.